Hi, my name is Jeff Legas, and I'm the Medicine Development Leader for Tafinlar and Mekinist. And on behalf of GSK, I want to thank NORD for honoring both Mekinist and Tafinlar for the 2013 FDA approvals for the treatment of patients with BRAF V600 mutant metastatic melanoma. I'd also like to congratulate my fellow industry colleagues here on stage with me on the receipts of their awards for the Partners in Progress. It's somewhat surreal to be standing here in such a beautiful museum here in DC with so many folks that have devoted their lives to trying to help patients with these rare diseases. And it's even more surreal recognizing back to when I first started my journey in melanoma and the insurmountable hurdles that were put in front of us. In just 2009, there was nearly 4 decades where no progress has been made. And at the time, the average survival for these patients was just 6 to 8 months. And actually 9 inhibitors of the pathway that we were working on had failed in clinical development. Metastatic melanoma is and remains one of the fastest growing cancers, and it's the second leading cause of productive life years lost. As I think about the theme here tonight around this Portraits of Courage, I would not be standing here if it wasn't for the courage and perseverance of so many folks that we've worked closely with over the years. In particular, I do want to acknowledge my colleague, my friend, my team member, Doug DeMarini, who's over at table 16, who's really been the champion of this product since its inception back in 2006. Secondly, I'd like to acknowledge the patients and their families that participated in the clinical trials. They are the real heroes here. They have an immeasurable amount of courage, and they would not have had the fortitude if it wasn't for the resilience and outstanding support, advocacy, and education of organizations like NORD. To date, our drugs have been used in approximately 7,500 patients with metastatic melanoma, but that's only a fraction of lives that we've touched compared to NORD's outreach, impacting nearly 30 million Americans. You know, a quote from Helen Keller once said, "Alone we could do so little, but together we can do so much." I think that's an exemplar for the partnerships of the BRAF inhibitor and the MEK inhibitor, not only within GSK, but also with our colleagues from Roche. We'd worked very closely with the NIH, the FDA, the Melanoma Research Association, and numerous other partnerships to bring these new medicines to patients within just 5 years, which is half the time of the historical development life cycle for these drugs, thus getting our medicines to patients much sooner. This integrated way of working and personalized medicine approach clearly demonstrated how excellent laboratory science can be translated into the clinic. And thanks to our partnerships with the companion diagnostics, we were able to identify and treat the right patient at the right time with the right medicine. And as I reflect on what this milestone and what this award means to me, as the medicine leader for this asset, making a medicine is one of the greatest professional accomplishments one could ever achieve. But making a difference for even one single patient with this devastating disease is a life-altering personal reward. I'm proud that GSK has been part of this step change for patients with metastatic melanoma, which in just 5 years has gone from an untreatable disease to an actual prototype as to how we discover and develop new drugs in this era of personalized medicine. And with the recent approvals of our 2 products in conjunction with the Roche drug as well as BMS's drug, the average survival of this patient population now exceeds 2 years compared to the 6 months just 5 years sooner. But despite this significant progress, our journey is not complete. These patients still succumb to this devastating disease. GSK remains committed to fighting cancer in the era of precision medicine and looks forward to continuing our work in oncology research and development and in partnership with these outstanding organizations such as NORD. We're truly honored to receive this award, especially here in the month of May, which actually is Melanoma Skin Cancer Detection and Prevention Month. It's time for us to reflect on the progress that we've made and for the patients and for the fulfilling GSK's mission to help patients live longer, feel better, and do more. And again, on behalf of GSK, I want to thank you for this honor here tonight.